Thank you, Mr. Speaker. I rise for another in a series of Republican freshman class special orders, this time to focus on the need to repeal Obamacare in a vote in this chamber later this week. The President and many of our colleagues on the other side of the aisle proudly refer to this health care law as Obamacare. But we should neither be proud of the process that led us to this point nor the resulting policy mess. The 2,800-page bill was crafted behind closed doors and rushed through Congress in 2010 with limited debate and without amendments. The predictable result is a flawed product that expands the federal government's role in health care, raises taxes on employers, and mandates benefits that will increase health care costs for most. Remarkably, there already have been more than 20,000 pages of regulations issued regarding this bill's implementation. I would like to start by recognizing my distinguished colleague, the gentlelady from Missouri, for 3 minutes for remarks on this important issue. You want to come here?
Yes, please.
Super. Great.
I thank the gentleman from Indiana for yielding and for organizing these special orders this evening. Mr. Speaker, I rise today in support of H.R. 45, a bill that will repeal the President's devastating health care reform law, commonly referred to as Obamacare. When promoting the health care reform legislation to the American public, the President and members of his party told people that if you liked your health insurance, then you could keep it. That the penalty Americans have to pay under the individual mandate was not a tax, and that those with pre-existing conditions would have access to health care. Well, as many of us suspected then, these claims were nothing more than blatant lies. In fact, the Congressional Budget Office recently said that 7 million people will lose their job-based health insurance due to Obamacare. The Supreme Court has affirmed that what we already knew, that Obamacare's penalties are indeed taxes. And on February 15th, the Obama administration announced they would not cover over 40,000 patients suffering from pre-existing conditions. Mr. Speaker, friends, this should not happen in America. We need to repeal this law, and we need to do it now. Today, though not fully implemented, Obamacare has already had many destructive effects on the American people, real people with bills to pay, mouths to feed, and jobs to do. Since Obamacare was signed into law, many of the new taxes in the President's $1 trillion tax hike have gone into effect, most of which target the middle class, increase the cost of health care, and stifle job creation. The law continues to take its toll on small business. I hear from mom and pop operations throughout the St. Louis region that are not hiring needed workers or reducing full-time employees to part-time workers for the sole purpose of being able to keep their doors open as a consequence of the new Obamacare regulation. And the impact on jobs already is unmistakable. Obamacare promised 4 million jobs, including 400,000 almost immediately. Yet we know the truth, that the Obamacare is destroying jobs and costing the American dream for millions of America. Just today, a Missouri hospital announced that it was eliminating 129 good-paying jobs. The reason? Obamacare. These are the facts. These are the real jobs, and this law is hurting real people. It continues. Premium costs continue to rise on hardworking families across the country. Premiums for the average family have already grown by $3,000 since 2008, despite promises by the Obama administration that Obamacare would decrease premiums $2,500. Premium costs are expected to double, triple, and even quadruple for many Americans when many provisions of the law go into effect next year. The greatest effect will be to young people in this country who are already struggling to find jobs, pay off student loans, and grow healthy, prosperous families. These young people will be stuck between paying for insurance they cannot afford and being subject to burdensome tax. Mr. Speaker, I will close by addressing the shameful raiding of Medicare by this irresponsible law called Obamacare. Despite promises to the contrary, Obamacare has gutted Medicare to the tune of $716 billion. Nearly $750 billion stolen from our greatest generations to pay for this devastating law. Every day, more and more doctors are refusing to see Medicare patients because they simply cannot afford to do so. Is this how we pay back our seniors? With reduced benefits, reduced access to health care, and reduced respect for their quality of life. We owe them more. We owe the American people more. Mr. Speaker, the facts are clear. This law is wrong for America and needs to be repealed immediately before any more of its harmful provisions are implemented. I yield back.
Thank you, Mr. Speaker. I thank the gentlelady for her remarks. Many of the promises that were made to justify Obamacare's enactment have been broken. The results of these broken promises are hurting hardworking American families, workers, and businesses today, and will hurt them even more in the future, which is why House Republicans will be voting to repeal this government takeover of health care later this week. Through the course of this special order, we will look at some of those broken promises. Would next like to recognize my good friend, my colleague from North Carolina, Mr. Pittenger.
Thank you, Mr. Speaker. I rise today to join a chorus of individuals who are calling for the repeal of the Affordable Care Act. Mr. Speaker, it's not even affordable. The CBO says that it'll cost $1.8 trillion just to employ. Blue Cross Blue Shield in North Carolina says the premiums are going to go up 284%. We can't afford this. 7 million people won't be able to keep their own policies. There's no risk pool now, no funding for it, no provision. Even a Democrat senator and the Max Baucus, finance chairman, says this is a train wreck getting ready to happen. You know, Mr. Speaker, last January I sponsored a seminar in my district that brought together 400 business leaders. And the purpose of this seminar was to explain Obamacare. We had the Cato Institute, we had AARP there. And Mr. Speaker, what they heard was a resounding, what in the world have we done? They were so concerned about what Obamacare was going to do to their own businesses. They were afraid to hire people. They thought they'd let people go. And you know what they saw, Mr. Speaker? This chart right here. This chart, what a quagmire to process through to try to get real health care. It can't be done. We can do better. That's why with Congressman Hudson, I've introduced a bill called auto-enroll. This is a little provision put in the health care law, one of those provisions that I believe Speaker Pelosi said we're going to read it after we vote on it. We're going to learn about it then. Well, we've learned about it. What have we learned? That the companies have to automatically put people on their health care plan. And this bill says, no, you can opt out. You don't have to comply. Students who are already on their parents' health care, they shouldn't have to do this. You have temporary people who are working during seasonal work time in major retail or in restaurants. They shouldn't have to be on this, yet they're required to. This bill will allow some flexibility for employers. You know, the American people were told, we're going to provide you a champion thoroughbred horse who's going to go win the Kentucky Derby. And you know what they got, Mr. Speaker? They got a maimed, blind, deaf, crippled horse that can't even make his way around the track. That's what we have with Obamacare, but we're going to do better. We're going to provide for the American people at the right time, and we can do this. Competitive markets. They can cross the state lines, hundreds of companies competing, drawing down the cost of health care. This needs to be done now. We can get rid of the frivolous lawsuits that are driving the cost of health care up. The American workers, responsible people, hard-working taxpayer Americans, they deserve better, and we're going to do it. Thank you, and God bless you.
Thank the gentleman for his remarks. Would next like to recognize my good friend, the distinguished gentleman from Utah, Mr. Stewart.
Mr. Speaker, thank you, and thank my good friend, Mr. Messer. You know, I've been blessed to do a lot of fun things in my life, to do a lot of interesting jobs. I was an Air Force pilot for 14 years. That was maybe the funnest thing I've ever done. I was a writer. I've written 15 books. That was very satisfying. But the hardest job Without question, the hardest job I've ever done was to be a small business owner. As a small business owner, you fight every day to make ends meet. You care about your employees. Your employees become your family. And one of the funnest things to do is to hire new people, but one of the hardest things to do, and one of the most, frankly, discouraging things you have to do, is when you have to lay people off. But that is exactly what has happened in the business that I owned. That is exactly what is happening now. And that is what is going to continue to happen. Jobs are being killed by the implementation of Obamacare. And that's not a statistic. That isn't some government projection. It isn't some estimation from CBO. That is a fact. It is a reality. Obamacare is killing economic activity. Obamacare is killing jobs. And it's only going to get worse. There's a reason that the Democrats, and I'm not talking about the Republicans, I'm talking about Democratic leaders. There's a reason that they are calling Obamacare a train wreck. There's a reason why Nancy Pelosi said, we have to pass this bill before we can find out what's in it. This is like taking the lid off a garbage can that's been sitting out in the sun too long. The longer it's out there, and the more we know about this legislation, the worse it is. 400%. 400%. That's how much some people's premiums are going to go up because of the implementation of Obamacare. The President promised, in fact, the entire purpose of the Affordable Care Act was to drive premiums down. And instead, we see exactly the opposite. 30%, 80%, 400% increases in health care premiums. All of us Americans have become familiar with new words over the last year or two. We've learned about sequester. We heard a lot about the fiscal cliff. And the new government phrase of the year is going to be rate shock. You're going to hear about that all the time beginning this fall, because people will be shocked, and businesses will be shocked, and jobs will be lost, and people will be hurt because of the implementation of Obamacare. Please, let's take the opportunity to repeal it now. We can do better. We can write something and to design something that is better. Let's take the opportunity to do that. Thank you for this little bit of time, Mr. Messner, and Mr. Speaker, I yield back.
Thank you. Thank the gentleman for his remarks. Would quote for you broken promise number 1 of Obamacare. If you like your current health care plan, you will be able to keep it. Not true. The Congressional Budget Office estimates that nearly 7 million people will lose their employer-sponsored health care coverage under Obamacare. Would next like to yield to my good friend, the gentleman from New York, Representative Collins.
I want to thank the gentleman for holding this special session tonight. And Mr. Speaker, the American public is often concerned there's not enough agreement in the halls of Congress. Well, I'm pleased to report that there is growing agreement among both parties and in both houses of this Congress that Obamacare is truly a train wreck, as recently described by Democrat Senator Max Baucus. As this massive piece of legislation is being implemented, the negative impact it is and will have on our economy is becoming clearer. Obamacare guts the funding for Medicare Advantage to help cover its growing price tag. So for all those seniors out there like my 86-year-old mom who are happy with the health care coverage they receive through Medicare Advantage, I have news for you. You can't keep your existing plan as promised because Obamacare effectively ends it. And what the administration could not raid from other sources to pay for Obamacare, it makes up in new taxes. Just last week, as chairman of the Small Business Subcommittee on Health and Technology, I heard from the small business owners and advocates about the impact the health insurance tax will have on the bottom line of America's small businesses. The amount of that tax will be $8 billion in 2014, increasing to $14.3 billion in 2018, and increases based on premium trends thereafter. Supporters of Obamacare will say these fees are supposed to be paid by the health insurance companies. But common sense, substantiated by independent studies, tells you the insurance companies are passing these costs directly to consumers in the form of higher premiums. To avoid the taxes and fees, companies are cutting jobs, not hiring, and reducing employee hours to stay under Obamacare thresholds. All this at a time when national employment remains embarrassingly high. Obamacare is built on the premise that the young and the healthy will pay to insure the old and the sick. Well, guess what? The young and the healthy are too smart to have their pockets picked. Knowing they can't be denied coverage down the road, the young and the healthy are going to drop out of the insurance market and instead pay the $95 penalty and their out-of-pocket medical expenses. They know this approach will be far, far cheaper in the end than paying thousands of dollars for an individual or family plan under Obamacare. It's like not buying collision insurance on your new car because you know you can get it after you've been in a wreck. When attempting to defend Obamacare, its supporters like to tout all those free things that Obamacare offers the American people. That sales pitch crystallizes what is wrong with Obamacare and the tax and spend policies this town is famous for. Nothing is free in this world. For every free service Obamacare offers, someone out there in America is paying for it with their hard-earned money. Or worse yet, we'll just add a few more bucks onto our staggering debt to cover this so-called free service. This country can't afford Obamacare figuratively or literally. Obamacare must be repealed. It needs to be replaced with common sense, cost-effective ways to improve health care in this country. Mr. Speaker, I yield back the balance of my time.
Thank you. I thank the gentleman for his remarks. Would next like to recognize my good friend, the gentlelady from my home state of Indiana, for her insights on this important special order.
And thank you to the gentleman from Indiana for organizing this, Mr. Speaker. I rise today in strong support of H.R. 45, the repeal of the Affordable Care Act. Obamacare is bad for the young and for the elderly. I recently received a letter from a high school senior in my district. She noted that her family's out-of-pocket premium costs have risen $7,000 in recent years, while their deductible has increased tenfold. She said she worried about how she's going to pay for health care on her own in the future. She is right to worry. According to a study published by the American Academy of Actuaries magazine, 80% of Americans under the age of 30 will face a premium increase because of Obamacare. The costs of Obamacare are more than monetary. Americans will also have fewer health care choices because of it. Specifically, the Independent Payment Advisory Board will threaten the options available today to Medicare recipients. This board of 15 officials will get to choose which treatments and which procedures Medicare will reimburse and which it will not. What a doctor prescribes or what a patient needs will come second, if at all. The IPAB is unelected and won't report to members of Congress or any elected official. The budget for this board is given directly by the executive branch. IPAB doesn't even have to justify its finances to the public. My friends on the other side of the aisle like to say Republicans want to change Medicare as we know it, but in fact it is Obamacare that is changing Medicare, putting bureaucrats in charge of decisions that should be between senior citizens and their doctors. Repealing Obamacare will right this wrong for the young and for our seniors. I urge adoption of this important bill and yield back.
Thank the gentlelady for her remarks. Would next like to recognize my good friend from the state of Florida, Representative Yoho.
I'd like to thank my colleague from Indiana. Thank you, Mr. Speaker. I stand here today in support of the repeal of in support of H.R. 45, the repeal of the Affordable Care Act. It's not just the House Republicans that want this or House freshmen that want to repeal this law. It's the American people. The American people don't like this. The people of my district overwhelmingly desire the repeal of this legislative debacle. Let's face it, in 2009, with a Democratic Congress, this bill was passed through and passed in March in the twilight hours. The Speaker said, and I think we all remember those infamous words, we have to pass it to see what's in it. We have to pass it to see how it's going to work. America deserves better. Americans deserve better, and they demand better. The Affordable Care Act is the #1 job-killing bill in America. When the President speaks of job creation and stimulating the economy, the 800-pound gorilla in the room that nobody talks about is the Affordable Care Act. It's the #1 job-killing bill, bar none. A couple of examples. I had a person call in today. This young lady said, one of my constituents said, that even though she doesn't have insurance, it's because she doesn't have a job. And the reason she doesn't have a job is because of this bill. It's getting in the way of job creation. Another business owner I know, he's got 350 employees. And I asked him how the effects of this bill was going to affect his business. And he says, let me tell you about this bill. I could expand my business right now, and I could add 100 new employees, but I'm not doing anything because of the estimated cost of this bill. Now think about that. That's one man's bill, or one man's business in one town in America. How many businesses in America throughout this country are not expanding because of this bill and the uncertainty? It's got to stop. There's a county in our district, Clay County. I was talking to one of the municipal people there that was in charge of the health care. He said the estimated cost coming up because of the Affordable Care Act was going to cost $15 million. $15 million. Then they figured out if they didn't comply with the Affordable Care Act, what that cost would be. It would be $5 million. What choice do you think they're going to make? They're either going to lay off people or they're going to not cover people. They'll pay the fine. There's in my own town, in Alachua County, there's a contractor. He's got 51 employees. He's bidding on a job against another contractor that has 49 employees. The estimated cost to him is $2,000 per employee. So this contractor with the 51 is starting on the same line with this guy that has 49, and he's going to owe $102,000 more in his opening bid. And I asked him what he's going to do, and he says, most common sense thing to do is to lay off some people so I don't have to pay for that. And again, I hear this story over and over and over again. Mr. Speaker, it seems the President himself doesn't really like his plan that much either. In spite of all the glowing speeches he gives, the President himself has signed into law. He has signed into law himself, Mr. Speaker, repeals of certain Obamacare provisions on seven different occasions. When the President claimed that his plan would lower the cost of health care for Americans, he left out the fact that about 7 million Americans would just lose their health care altogether. Estimated insurance costs for the younger generation, they can expect their insurance premiums to increase from what they are today, 150 to 175%. When the President claimed that under his plan, no family making less than $250,000 a year would see taxes increase, he completely left out the fact that there are 21 new taxes in this bill. And these are taxes that are on not just the wealthy, but all Americans at all income levels. It's a bad bill, and this is not what America wants. The whole point of the Affordable Care Act was to create health reform, which implies not just health care, but health prevention. But what happens is with this bill, the Supreme Court said, after 3.5 years of this bill being out there and reviewing it, they said it's not health care, it's a health tax. And the bottom line is it's going to create where people have less insurance. And then we have to think about who will collect these taxes. The IRS. The very same IRS that's under a criminal investigation we found out today. Americans don't want this. Americans are a caring, generous, and a charitable people. We will always make sure that the least fortunate among us are cared for. The President's plan doesn't care for the less fortunate. In fact, it makes us all less fortunate. Our vote this week is not about politics. It's about being responsive to the people and adhering to the Constitution. We represent the people who are being hurt the most by the Obamacare bill, and we owe it to them to relieve them of this burden. If we truly want to create jobs, the full repeal of Obamacare is the first step in jump-starting our economy. And I'm proud and thankful to be able to be part of the process of repealing this legislative disaster and replace it with a common-sense health care reform. And I yield back my time, and thank you.
Thank the gentleman for his comments. Thank my colleagues for their stamina and patience. Would next like to recognize my good friend, the straight-talking member from Oklahoma, Mr. Bridenstine. You're towards the end.
Well, I'd like to thank the gentleman from Indiana for allowing me to speak on this issue on behalf of my constituents. I can say very clearly that I support H.R. 45, Obamacare repeal, and I can tell you why. Under Obamacare, we're looking at a minimum of about $500 billion in new taxes. We're talking about taxes on pharmaceuticals, taxes on medical devices. We're also talking about taxes on payroll, things that have nothing to do with medicine, taxes on the sale of real estate, taxes on other capital gains, 21 new taxes. $500 billion is the conservative estimate. Some people say it's going to be $1.1 trillion new dollars in tax revenue. But guess what? It's not enough. So there's also going to be $500 billion in new borrowing over the first 10 years of Obamacare, and it's still not enough. So we're going to rob $716 billion from Medicare at a time when seniors are finding it hard to find providers who are willing to accept Medicare as it is. This is hugely problematic for the people in my district. Let's talk about the employers. Employers are seeking ways to reduce their staffs below 50 people. They're laying people off. No kidding. I talked to an employer just a few weeks ago in my district. He's got 57 employees. He's trying to get down to 49. He's also trying to figure out ways to get his staff so that they're part-time, trying to get his staff under 29 hours so he has less than 50 full-time equivalents is what they're calling them now, full-time equivalents. So this is going to be a disaster for the employment prospects of the people in my district. And let's talk about how this is administered. It's going to be administered by the IRS. So everyone has to have the health insurance that perfectly conforms to what the president wants them to have. It used to be that there was a time when my wife and I had insurance where we had a high deductible and a low premium. We had a little bit of savings. We wanted to save money on our premium, so we were willing to accept a high deductible, willing to accept a little bit of risk upon ourselves to save money. Well, that's not available anymore under Obamacare. And it's going to be enforced by the IRS. So if you have that high deductible, low premium policy, or if you have a policy that they call a Cadillac plan, you're going to be penalized. Those penalties have been ruled by the Supreme Court to be taxes. But let's be clear, they are penalties for not conforming to what the president wants you to have within health insurance. That penalty, if you don't have the right health insurance, is going to be 2.5% of your income eventually. So if you make $50,000 a year, your penalty is $1,250 assessed by the IRS when you do your taxes. Or you could pay the premium. If you want the comprehensive health care that Obamacare requires you to have, that premium is likely to be around $7,000, or you can pay the penalty, $1,250. What are most people going to pay? They're going to pay the penalty. Why? Because under Obamacare, they can't exempt you for a pre-existing condition. So you can pay the penalty, and then when you get sick, you can go to the doctor and get the health insurance you need and then get healthy. And then when you're healthy, you can drop your health insurance again. This creates an adverse selection. This is a big problem. If you want to see health insurance premiums skyrocket, let's only insure the people who are sick. And that's exactly what this bill does. Let's talk for a second about the expansion of Medicaid under Obamacare. I'm very proud of the state of Oklahoma for not expanding Medicaid under Obamacare. This is a teaser rate. This is a time when the federal government comes in and they say, we're going to fully expand your Medicaid expansion up to 138% of the poverty line for the first 3 years. Then we're going to pull the rug out from under you. And the state of Oklahoma is going to be faced with challenges. What are we going to cut? Maybe we'll cut education. Maybe we'll cut the Department of Transportation in the state of Oklahoma. Or maybe we'll raise taxes. This is just another way for the federal government to addict states to a program that ultimately they're going to pull the rug out from under the program, and the state of Oklahoma is going to be forced to carry this load. And I'm very proud of Governor Mary Fallin for not expanding Medicaid under Obamacare. I'd like to thank the gentleman from Indiana for allowing me to express my views. I fully support H.R. 45, the repeal of Obamacare.
Thank the gentleman for his remarks. Mr. Speaker, I'd like to inquire as the amount of time we have left.
Approximately 30 minutes.
About 30 minutes?
Yes.
30? Okay, great. We're right on pace. Would next like to recognize my good friend, the gentleman from Pennsylvania, Mr. Rothfuss.
I thank the gentleman for yielding and for organizing this important discussion with our freshman colleagues. President Obama made big promises while pushing his health care law through the House and Senate. He promised that the American people, he promised them that it would create jobs, that it would increase access to health care, that it would promote economic growth, that it wouldn't add to the deficit, that it would not raise taxes on the middle class. He promised that if you liked your health care plan, you could keep it. He said that it would lower the cost of premiums. He said that it would strengthen Medicare. 3 years later, President Obama's health care law has proven to be a string of empty and broken promises. We are seeing premiums rise. One business in my district that employs 13 workers expects a 26% increase in its premiums, totaling more than $30,000. That's $30,000 that cannot go to increasing wages for workers. Another company in my district with 17 employees expects a 19% premium increase, with an annual cost of more than $20,000. Companies are being forced to change their health plans and pay more for them. Some companies may even drop their plans and put their employees in the Obamacare exchanges. That means that they're not keeping their plans. That's a broken promise. Obamacare is also raising taxes on the middle class. The Supreme Court made that clear. One little-known tax in Obamacare is a medical device tax. This is a tax on the middle class because it's going to be passed directly to the consumers. Pennsylvania has the fourth largest medical device industry in the nation. The medical device tax threatens healthcare businesses and innovators like Zoll Medical Corporation in my district that supports 600 good-paying jobs. Obamacare does not strengthen Medicare. It cuts $716 billion from the program and creates the Independent Payment Advisory Board, also known as IPAB, which puts unelected bureaucrats in between seniors and their doctors. President Obama's health care law is causing folks to lose their health plans, it's raising taxes, it's hurting Medicare, it's increasing the deficit, and it won't bring universal coverage. More than 30 million people will still be uninsured in 10 years. The fact remains that 3 years later, President Obama's health care law is a $1 trillion string of broken promises. It's damaging our families, seniors, hardworking Americans, and their health care. It's killing jobs, and it's violating the First Amendment rights of people of faith. It's a small wonder that even some of the authors of this misguided health care law are calling it a train wreck. The American people deserve better. This law should be repealed. Then all members of Congress should sit down and do their jobs to craft common sense, patient-centered reforms that reduce costs, preserve Medicare, and increase access to all Americans. Thank you, and I yield back.
Thank the gentleman for his comments. I'd like to talk right now about Obamacare broken promise number 2. The president promised, quote, "I will not sign a plan that adds one dime to our deficits, either now or in the future." The truth, Obamacare will end up adding, according to a GAO report, more than $6.2 trillion to the debt over the long run. Would next like to recognize my good friend from Michigan. Sing it with us, Mr. Bentivolio.
Thank you. Gentleman from Indiana, thank you very much. Mr. Speaker, I rise today to talk about the Unaffordable Health Care Act. I'll admit it, I'm standing here because of it. The Unaffordable Health Care Act is what made me realize that Washington was out of control and run amok. It made me realize that the people of this great country needed a voice. Whenever I think of the proceedings that gave us this massive health care law, the words, "We must pass the bill to find out what's in the bill," ring in my ear. It makes me cringe. My friends on the other side of the aisle are good people. They passed the bill because their leadership assured them that it was good law. I don't think they purposely wanted to harm the country. We now know what's in the bill, and it's not good. I'm confident that my friends wouldn't have voted in favor of Obamacare had they known that the bill empowered the IRS to bully people about their health insurance, or that the new law created a rationing board to decide who gets treatment and who doesn't. Had the bill been read, I don't think it would have passed. On top of repealing this law, we must reform how business gets done in the Capitol. That's why I've introduced Read the Bills Act. The law is easy to understand. Before we pass laws which will impact millions of hardworking Americans, Congress must read the bill. This is the kind of bill that will help restore the faith in Congress of those who send us here to represent them. Let's get rid of the notion that we have to pass bills to find out what's in them. Please join me in repealing Obamacare and supporting the Read the Bills Act. Mr. Speaker, I yield back my time. Thank you.
I thank the good gentleman for his comments. Would next like to recognize my very good friend from the great state of Georgia, Mr. Collins.
Well, I appreciate the gentleman for yielding. I tell you, this has been a great time tonight. It's a great time in the sense that we get to stand here and explain to the American people what they were not explained to a few years ago. It's a good time to explain to them what they were sold as being something good and something that was going to help in health care. Remember, this bill says health care in its title. But the truth of the matter is, it's not about health care, Mr. Speaker. It's about control. It's about who's going to control health care, who's going to control what our government is getting into and what our government should stay out of. I fully support this week of voting to repeal Obamacare and moving forward with an agenda that promotes jobs, that creates better opportunities. Because you see what is happening tonight is my colleagues and good colleagues have stood here. They've talked about the problems with business. They've talked about the problems with taxes. They've talked about the broken promises, as my colleague from has stated, that the broken promises of keeping your own health care, of it not adding to the debt, all of which are lies. Things that are not truth, that were not talked about on this House floor just a few years ago. So my problem with this is, let's be honest. Let's talk about what it does do. It begins to make a regulatory framework that is amazing. It wasn't a matter if you read the bill. It didn't matter if you read the bill in 2009 because you wouldn't have known what was in it. Because at the end of almost every paragraph it would say, oh, by the way, we're going to let this agency promote the rules and regulations. It wasn't. You could have read every page and you would have just known that more bureaucrats were going to tell you what health care was going to be like. 20,000 pages of regulations are already on the books. 828 pages in one day. But we're paying a lot of folks to do a lot of regulation writing. We're paying a lot of folks to take away the basic rights that we're looking at. You see, you can make an argument that this wasn't about health care. This was about broadening regulatory authority at HHS and at IRS. Oh, wait, IRS. Any thoughts this week about letting them be the regulators of who's paying and who's not paying in our health care system? Excuse me, we're having trouble doing what their job is. We don't need them in health care. We've got bigger problems here. But when broken promises come about, we have to remember what has disturbed me the most about this whole debate tonight is we've heard about businesses, we've heard about taxes, we've heard about some broken promises, but what we've not heard about is health care. We've not really heard about health care and a doctor and patient. As a doctor told me the other day, he said, just let me practice medicine, which is all I want to do. You see, it's time we talked about health care. Because this law, instead of helping those who need help, it kicks them off insurance. It makes people pay more and does all the things that it was promised not to. Doctors are getting out, new doctors are not going in. And you know who's lost? I can see it right now. The picture that I have in my mind is those waiting in the waiting room, wanting to see a doctor who need health care, and this law simply leaves them waiting. Let's don't do that. Let's repeal this law. Let's get on with the real business of this House. I appreciate the gentleman. I yield back.
Thank the gentleman for his remarks. I want to recognize my good friend from Montana and let my good friend from North Carolina know how much I appreciate his patience, and he is the next man up. But with that, I want to recognize my friend from Montana, Mr. Daines.
Thank you to my good friend from Indiana, Congressman Luke Messer, for arranging the special order in preparation for Thursday's vote to repeal the President's health care law. Earlier today, I emailed my constituents a quick survey back home in Montana with one simple question. Do you support efforts to repeal President Obama's health care law? We've seen already overwhelming response to our office here tonight from Montanans across our state. Combined with the letters, the emails, the phone calls we received, by 3-1, Montanans want to repeal Obamacare. Last week, I had a teletown hall meeting so I could hear from the people of Montana about the issues that matter most to them. The last question I was asked, at the very end of this hour-long teletown hall, was from a woman from Florence, Montana. It's a small town on the western side of our state. She shared her heartfelt concerns about the health care law and how it was going to affect her small business. Between the costly new rules and regulations and rising health insurance premiums, she didn't know how she would be able to follow the law and keep her business afloat. And these challenges aren't unique to this one small business owner from Montana. Families and small businesses across America are struggling under President Obama's health care overhaul. Rather than providing real solutions to increase access to affordable care, Obamacare is driving costs up, it's hurting small businesses, it's raising taxes on Americans by more than $1 trillion over the next decade, and ultimately puts the government directly between patients and their doctors. This law also hurts our seniors and their access to health care. The President's health care law took more than $700 billion out of Medicare to pay for new Obamacare spending and established this IPAB, this unaccountable, unelected board of bureaucrats empowered to further undermine seniors' access to medical. And following this week's troubling news from the IRS, it makes it very clear that the IRS should not be in charge of enforcing Obamacare's core provisions. We need to repeal Obamacare to strip them of this authority. Furthermore, the President's health care overhaul sets in motion serious violations of America's religious freedoms. Under Obamacare, the Department of Health and Human Services has mandated health care coverage of products and services of which some Americans are morally opposed. Under this mandate, religious institutions and employers, as well as health care providers who hold religious and moral convictions, are stripped of their religious freedoms. This is a clear violation of America's First Amendment rights, and it is of critical importance that the religious and moral convictions held by many Americans are protected. That's why I recently joined more than 90 of my colleagues here in the House in calling for the upcoming House appropriation proposals to contain full protections for Americans' religious liberties and conscience rights by including provisions found in the Health Care Conscience Rights Act, which I helped introduce in March. But we must also continue fighting to repeal this failed law in its entirety. We know that our health care system is complex. It has major problems. They need to be addressed. But Obamacare only makes the matters worse. The President's health care law takes us in the wrong direction. At the end of the day, it will result in higher costs, higher premiums, and forces millions of Americans to lose the coverage they currently have. And let's just remember something from 3 years ago. Remember in March of 2010 when Obamacare passed the House? There was nothing bipartisan about Obamacare. There was bipartisan opposition. In fact, 34 Democrats joined 178 Republicans in opposing Obamacare, but not one single Republican voted for it. There was nothing bipartisan about it other than bipartisan opposition. I will vote to repeal this law on Thursday. I will continue to work with my colleagues in support of better, more effective solutions that give Americans the quality, affordable care they deserve.
Thank the gentleman for his remarks. talk to you briefly about broken promise number 3. The President promised that, quote, coupled with comprehensive reform, our bill could save families $2,500 in the coming years. The truth? Just the opposite has happened. The average family premium has grown by more than $3,000 since 2008. In Indiana, residents are expected to face some of the highest health care insurance cost increases in the nation, amounting to more than 60% for many and as high as 100% for some. I next would like to recognize my good colleague, a man who's shown the patience of Job this evening as he's waited with great stamina, the gentleman from North Carolina, Mr. Holding.
Thank you, Mr. Speaker, and thank you to my friend from Evansville, Indiana, Mr. Messer, for the time. Mr. Speaker, few things in life are more personal than health care. The care we receive as individuals, the treatment our children receive, the treatment our friends and our loved ones receive. And beginning next year, Mr. Speaker, the government will dominate this personal arena. Dismantling this failed attempt at health care reform needs to be a priority of this Congress. Mr. Speaker, time and time again, I hear from the medical professionals in my district, those who have dedicated their lives to serving others, about the uncertainty Obamacare is causing them. What regulations and rules are going to come down from HHS and step in between the care that these medical professionals provide their patients? What treatments will they be able to provide? How many hoops are they going to have to jump through to get the procedures and tests that their patients need? How many hoops will they have to go through to get that approved? Mr. Speaker, Obamacare has also harmed small business in all sorts of unimaginable ways. Small businesses are what drive this nation's economy through innovation and good old-fashioned sweat equity. They are a testament to what built this country and made it great. But this law, Mr. Speaker, is causing many of them to make tough decisions about whether they can go out and hire that additional worker or employee, tough decisions if they can invest in the growth as they try to grow their company, and what other long-term impacts of Obamacare are going to have on their business. Many small businesses are struggling, and this law will only make things worse. We have heard about employers here tonight considering dropping coverage altogether because of the uncertainty. Providing health care benefits has served as a sense of pride for small business owners and has always been a means by which small business owners have been able to recruit and retain the best talent. This talent is what helps them be successful, but unfortunately, under Obamacare, providing health care is not going to be something that many small businesses do. 2 years ago, Mr. Speaker, the Congress repealed the misguided 1099 reporting requirement that was included in Obamacare. It was there to gin up revenue. In this Congress, I'm hopeful we can repeal the medical device tax. And I've co-sponsored a bill to do just that, one that enjoys overwhelming bipartisan support. Bipartisan support that is similar to the support shared for many of the misguided provisions of Obamacare and the wish to get in there and repeal them and rein them back in. You know, anyone who reads or watches the news knows that the Affordable Care Act, which, Mr. Speaker, probably should have been named the Unaffordable Care Act, as Mr. Bentivolio said earlier this evening, is costing more and more money just to get it up and running. Costs have ballooned, and the law hasn't even been fully implemented yet, or nearly implemented yet. State exchanges are requesting more and more federal dollars, which has sent the administration scrambling to pull dollars out of the so-called prevention fund. And Mr. Speaker, the CBO estimates that Obamacare may now cost twice as much as originally promised, at a price tag of $1.88 trillion through 2022. Mr. Speaker, we haven't even touched on what will, without a doubt, impact individuals and families the most, the cost of their premiums. This is what American families are the most concerned about. Since 2008, families have seen their premiums grow by over $3,000, and a new report by the House Energy and Commerce Committee, based upon actual industry numbers, suggests that rates may go up anywhere from 47% to 400%. Mr. Speaker, this law needs to be repealed immediately so patient-oriented reforms can be enacted that protect American jobs and actually deliver on the promise of affordable health care to individuals and families. Thank you, Mr. Speaker, and I yield back.
Thank the gentleman for his remarks. Would like to speak briefly about broken Obamacare promise number 4. President promised, quote, under my plan, no family making less than $250,000 a year will see their taxes increase. The truth, taxes have gone up for many, and not just the well-off. The Joint Committee on Taxation has issued a report detailing 21 new or higher taxes that will cost taxpayers more than $1 trillion. Indiana, which has a medical device industry that employs 20,000 Hoosiers with a payroll exceeding $1 billion, would be devastated by Obamacare's $20 billion tax on medical devices. Would next like to recognize my good friend from Indiana. Appreciate her leadership on this topic, Ms. Walorski.
Thank you to my good friend and my colleague from Indiana, Representative Messer, for organizing this special order tonight. It has been, Representative Messer, over 3 years since Obamacare was signed into law. In a recent Senate Finance Committee hearing, Senator Max Baucus told Health and Human Services Secretary Kathleen Sebelius that he now sees this bill as, quote, a huge train wreck. And I couldn't agree more. Obamacare is a huge train wreck. A few weeks ago, I held a roundtable discussion, and in many of the Chamber of Commerce's in my area, in each county in my district, I sat down with a wide spectrum of industries, ranging from agriculture to manufacturing. The prominent topic of each discussion was Obamacare, the uncertainty it creates for Hoosier businesses who cannot afford the overwhelmingly taxes and employer mandates. From longtime small business owners to aspiring startup companies, employers agree that Obamacare is largely responsible for smothering economic development. If the President and members of Congress were truly listening to the American people's opinion of this law, they would see the writing on the wall. We must repeal Obamacare. The state of Indiana is proud to be a global leader in the medical device industry that my colleague just spoke of. However, Obamacare is forcing a 2.3% tax on medical device manufacturing. This tax affects the orthopedic industry, causing rises in costs for seniors and veterans and patients in need. On the 3-year anniversary of Obamacare, I met with Complexus Medical in Mishawaka, an emerging leader in the orthopedic instrument manufacturing in the 2nd District. I was told this tax will stifle innovation, could force companies to consider overseas supply chains. The medical device tax is a great concern also for our veterans. That's why I led a letter, along with my colleagues from Indiana, to the Secretary of Veteran Affairs, asking how this tax will impact veteran care. After the sacrifice and fearless bravery demonstrated by our troops and our veterans, it is unacceptable for them to worry about their access to quality care. And it gets worse. Just this week, we learned more shocking news when the IRS admitted to targeting certain groups of people, a practice that is completely unlawful, unethical, and downright shameful. Their willful actions to defy transparency have already qualified the IRS for a comprehensive congressional investigation, with at least 2 hearings scheduled in the House in the coming weeks. But let's not forget, the IRS is set to play a major role in Obamacare, from enforcing the individual mandate to distributing the tax credits. If the IRS cannot operate under the light of transparency today with their current duties, I am deeply concerned that further responsibilities with sensitive information and controversial policies are a recipe for disaster. This bill, ladies and gentlemen, is spiraling out of control. It's time for Washington to heed the overwhelming evidence, wipe the slate clean to show the American people that we are listening. Now more than ever, the President and the Congress must restore transparency at the federal level. I support the full repeal of Obamacare and urge my colleagues to do the same. Thank you, and I yield my time back.
I thank the gentlelady for her remarks. As many other speakers have said tonight, Obamacare is big government at its worst. Federal agencies recently reported that it will take them almost 190 million additional man-hours per year for employers, families, and healthcare providers to comply with its onerous implementation regulations. That's nearly 95,000 new full-time employees just to do Obamacare paperwork. Now I'd like to recognize our final speaker of the night, one of the hardest working members I know in this chamber. I appreciate your stamina and persistence for being here. The gentleman from Kentucky, Mr. Barr.
Well, I want to thank the gentleman, my friend from Indiana, for his courtesy and for his leadership on this very important issue. And I join my colleague in supporting H.R. 45, the full repeal of Obamacare. And, Mr. Speaker, it is true. You've heard from the other members here this evening. You've heard about the importance of repealing Obamacare because it is legislation that is full of broken promises. We know that the signature promise of this legislation was that if you like your current health insurance, you can keep it. We know now that 7 million people will lose their employer-sponsored health insurance at least, which was nearly double the previous estimate of 4 million. We heard about savings. Remember, this was titled the Affordable Care Act, but in 2013, the Congressional Budget Office projection tags the total cost at $1.88 trillion. Premiums are not decreasing. Premiums are going up. The average family premium has grown over $3,000 since the passage of Obamacare. Individuals earning as little as $25,000 will pay more for insurance because of Obamacare. $1.1 trillion in new taxes and jobs. This legislation was supposed to create 400,000 jobs immediately. Speaker Pelosi promised that Obamacare would create 4 million jobs. Well, Mr. Speaker, small employers in Kentucky and central Kentucky tell me that Obamacare is the principal reason that they're not hiring. According to a study by the National Federation of Independent Business, the employer mandate, like the one included in Obamacare, could eliminate an additional 1.6 million jobs by 2014. Obamacare is creating an environment in which employers are incentivized to reduce hours for their employees to go to part-time work. The supporters of Obamacare are supporting a part-time work economy. We need a full-time work economy, and that's why we need to repeal Obamacare. It increases the federal deficit. According to a January GAO report, Obamacare will add $6.2 trillion to the deficit over the next 75 years. But, Mr. Speaker, I want to conclude with a story that illustrates why this really matters. There's a lot of statistics about jobs in the economy and increased premiums and cost, but the real signature failure of this legislation is that it hurts patients, that it deprives the American people of the benefits of medical innovation. A hospital administrator told me in central Kentucky that we used to take care of patients, but we now take care of paper. Medical innovation is central to America's future economic growth and to delivering new life-saving medical devices to patients. But the new medical device tax included in Obamacare, which imposes a 2.3% tax on medical device manufacturers, punishes medical innovation and prevents quality health care. And families around the country know this all too well. In my own family, we saw this up close. Christmas Day 2012 could have been one of the worst days of our life. Fortunately, it was the best day of our life. And it happened when my mother called me that morning, on Christmas morning, and said, "Andy, your father has had a fainting spell." And I said, "Can I talk to him?" And so she got him on the phone. And I said, "Dad, how you doing?" And he said, I need to drink a glass of water. And I said, "Well, stop drinking any more coffee. Calm down. Give me a call if anything happens." I got another call an hour later. This time it was from my mother again, and she said they were in the emergency room. My father had passed out a second time. And so I rushed to the emergency room, and I was greeted by the ER doc, and I said, "What's going on, doctor?" And he said, "Well, we did an EKG, and here are the results." And he showed me a flat line, and he said, "Your father's heart is slowing down." I said, "Doctor, what are we going to do about that?" And he said, "Well, fortunately, we can put a pacemaker in your father." And an electrophysiologist came down to the ER, and he reassured us, and he said, "We can put a pacemaker in your father, and we can make him better." So he went in to get that pacemaker surgery, and when he came out, he was recovering. And his life was saved because of that pacemaker technology. Mr. Speaker, the American people, American families depend on the innovative, unbelievable technology that American entrepreneurship has created. but Obamacare punishes that. And if it wasn't for that kind of medical innovation and technology, my father wouldn't be here today. So I stand opposed to Obamacare for all the reasons we've talked about here tonight, but most importantly because I credit the American free enterprise system for saving lives, and Obamacare rolls that back. And with that, I yield back the balance of my time, but I would certainly appreciate the leadership of the gentleman from Indiana for discussing the importance of this issue and the future of high-quality, innovative health care in America in the future.
I thank the gentleman for his moving remarks. I thank all of my colleagues for their remarks today. We're going to vote this week on repealing Obamacare. That vote is more than symbolism. Obamacare is wrecking this economy. Obamacare is terrible for patient outcomes. It needs to be repealed. I thank the gentleman and yield back the balance of my time.
Gentleman's time has run out. Has expired.